Serena Williams, one of the greatest athletes in human history. She's fit, she's wealthy and famous, but she almost died after giving birth. She told her nurse, quote, "I think I'm having a pulmonary embolism," because she knew her own body. She knew her history, but she was ignored and dismissed. It took her fighting repeatedly just to get a CT scan. So if Serena Williams couldn't get her symptoms taken seriously, what chance do the rest of us have? My name is Manuela Nganko. I am a labor and delivery nurse, a certified pregnancy coach and functional nutrition expert. And today we are talking about the number one reason Black women have a higher risk during pregnancy. And guess what? It has nothing to do with your body. The numbers are not an opinion. Before we go further, let me give you the facts. According to the Center of Disease Control, in abbreviated CDC, which is the government agency that tracks health in America, found out that Black women in the United States are 3 times more likely to die from pregnancy-related causes than white women. 3 times. And here's the part that really matters. This happened to Black women who have money. I just took the example of Serena Williams. Black women who went to college. This happened also to Black women with good health insurance. So it's not just about how much money you have. Something else is going on. Researchers have been studying this for years now. And one big thing they keep finding is that some doctors treat Black patients differently without even knowing that they are doing it. So let me explain what that means. I want to be careful here. I'm not saying that the medical system is evil. What I'm saying is that implicit bias is real. It is documented and it affects Black patients every single day, including during pregnancy. What is implicit bias? So let me explain what implicit bias actually means, because I heard a lot of confusion about this term. Implicit bias is not someone sitting in a doctor's office thinking, "I don't care about this Black patient." No, it is not conscious. It is not intentional. It is subconscious association built over years and years, which affect how someone perceives and responds to you without even realizing it. For example, in 2016, researchers studied medical students and new doctors. And guess what? They found out that about half of them believe that Black patients can handle more pain than white patients. That is not true. There's no science behind it. This belief was sitting quietly in the minds of people who were about to become doctors. Why does this matter during pregnancy? Because the most dangerous problems like high blood pressure, blood clots, and heavy bleeding after birth need to be caught fast. When a symptom gets missed or ignored, things can go wrong quickly. Think about what that means in a delivery room. You say, for example, "I have a headache and a blurry vision." Those are symptoms of preeclampsia, which is a life-threatening condition. Now, if your provider dismisses that anxiety or stress, guess what? That delay of your treatment can be detrimental for your health. And this is not rare. For example, Dr. Shalon Irving, a scientist at the CDC, the Center of Disease Control in America, she spent her life studying health problems in Black communities. She knew the numbers better than almost anyone. But after having her baby, she reported high blood pressure that was not taken seriously enough, and she passed away 3 weeks after giving birth. If it can happen to her, it can happen to anyone. So where does this come from? Let me give you the honest answer. So the first answer for this implicit bias is the underrepresentation in medical training. So for a long time, medical research was conducted primarily on white male subjects. Black bodies, black symptoms, black presentation were not the standard. That means that providers were trained on data that didn't include us. So the second cause of implicit bias is racial diversity gaps in healthcare. Study shows that black patients have better outcomes when treated by black providers. But black doctors represent only 5% of providers in the United States. The third cause of implicit bias is the strong black women paradox. So there is this cultural narrative that black women are strong, that we can handle more, than we don't need as much pain management or emotional support than white women. And that narrative is literally costing lives. Now, I'm not telling you this to scare you. I'm telling you this because knowledge is power. You deserve to walk into every appointment knowing what you are dealing with so you can advocate for yourself and your baby. In part 5 of this series, I'm going to give you the exact tools to do and what to say when you feel dismissed. But stay with me because we need to understand the full picture first. So what this means for your pregnancy. Here is what I need you to take from this video. Number 1, know that your instincts are valid. If something feels wrong, say it again and again until you feel heard. Number 2, you have the right to ask questions, request explanation. You can ask also for a second opinion. That is not being difficult. That is being your baby's first advocate. Number 3, that I want you to return from this video is that this is a systemic problem. It has nothing to do with you. It's not your fault. It's not a reflection of your strength, and it's not something you brought on yourself. In the comment section below, share with us if there has been a medical office where you felt like you weren't heard. Mama, know that I read all the comments, okay? You don't have to share the details. Just knowing that it happened helps me know how to help you better. So in part 2, we are going to talk about what stress does inside your body during pregnancy. And I think it is going to change how you see yourself. Save this video and share it with another mama. Thank you for watching. See you in part 2. Bye-bye.